The America's Democrats podcast, a project of 21st Century Democrats, is made possible by contributions from our listeners. Want to do more? Go to americasdemocrats.org and click Donate. And thank you for allowing us to be your voice. And if you enjoy the show, please share it with your friends on Facebook and Twitter, and leave us a review on your favorite podcast app. This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. I'm your host, Jim Cuddy. This week, making the case for fair maps and fair elections, fighting back against the effort to suppress young voters, plus an in-depth conversation about Donald Trump's response to the coronavirus pandemic. Had enough of Fox News, the House Freedom Caucus, and Donald Trump? If you want the facts that you won't get from them or from the fake news sites of the alt-right, then stay tuned. Our sponsor, 21st Century Democrats, works hard to get everyday Democrats involved in returning our party to its roots and to success at the ballot box. Sit back and listen, then stand up and fight. And follow 21st Century Democrats on Facebook for all the latest progressive news. We're glad you can join us. Through his work at Common Cause, Dan Vicuna is at the forefront of the fight against partisan gerrymandering and unfair redistricting. And as the 2020 census moves ahead, that fight is more important now than ever. And we say hello to Dan Vicuna, who's the National Redistricting Manager at Common Cause. Dan, welcome back to the America's Democrats podcast.
Hey, thanks so much for having me.
Always a pleasure to speak with you. 2020 is expected to be a huge year in terms of gerrymandering, in part because it is a census year. How will the census have an impact on states' ability to gerrymander, and where are we likely to see the biggest impacts?
Well, you're going to see a significant impact when it comes to the census and gerrymandering. So, in order to have fair districts drawn, you need to have accurate data in the first place. And so Common Cause is working hard with partners around the country to ensure that states are putting some money into funding hard-to-count communities that are often the most vulnerable when it comes to gerrymandering. They're often the communities that are sliced and diced when it comes to drawing districts. So ensuring that they are even counted, that they are visible when it's time to draw districts is a hugely significant first step. Another area where we're sort of fighting this fight as it relates to the census is that the Trump administration suffered a defeat in its attempt to place a citizenship question on the census that would have driven down minority participation. So that was a significant victory, but unfortunately, we're seeing an attempt to infuse census data with citizenship information in a different way through information that federal agencies have. This is the Trump administration's workaround to try to help states that want to disenfranchise people of color in the states. And that is being fought out in the courts right now. Some of our civil rights friends from groups like MALDEF and others are attempting to stop that infusion of data, which we think that many states, particularly those led by Republicans, are interested in drawing districts based not on total population, which has been the way we've done things for at least a century in this country, but based only on citizen data, which would make invisible in our democracy many people who happen to be non-citizens but who live and work in our communities and should be counted for the purposes of ensuring that communities have equal opportunities to obtain much needed resources to go about their daily lives. So the census is going to be a huge deal.
Yeah. Well, and then, of course, after the census weighs in, it's time for the politicians to weigh in. Who are the key political actors in each state who influence how districts are redrawn?
So in most of the country, 37 states, state legislatures draw districts. In most of those states, all but 5 of them, governors have a veto over the process as well. What we've seen increasingly, and at an accelerated pace recently, is the success of reform efforts at Common Cause, and many of our allies are pushing around the country, which is to take that power to draw districts out of the hands of elected officials, out of the hands of lobbyists and political operatives, and give it to ordinary citizens. We have in places like California, Arizona, and much more recently created in Colorado, Michigan, independent citizen redistricting commissions, which have strict conflict of interest provisions that prohibit political insiders from participating in the process, drawing districts that have strong transparency requirements to stop the years-long, decades-long process of drawing districts behind closed doors. So although in most states it's done by elected officials, we're fighting that fight to make sure that in more places the people have a voice.
And, of course, it's always worthwhile to remember what's at stake with gerrymandering. Communities of color are concerned that new maps could further shut them out of the political process. How concerned are you that this can happen?
Yeah, I'm very concerned. The long history of the United States is one of attempting to disenfranchise communities of color for political advantage, and one that has a very recent history when it comes to redistricting. You saw several states, Alabama, Virginia, North Carolina, and others that had maps struck down as illegal racial gerrymanders. What was primarily going on in these states was that communities of color were packed into as few districts as possible, so maybe they can win overwhelming majorities. For their candidate of choice could win overwhelming majorities in just one or two districts, but have absolutely no impact in the rest of the state and surrounding districts. It generally packed in far more people, far more African Americans, Latinos, into one or two districts than were needed to actually elect their candidate of choice. You saw maps struck down. I think that you will obviously see elected officials try to kind of toe the line, go right up to the border of what they perceive as legal in terms of making it harder for people of color to elect their candidates. So we're going to keep a watchful eye on it. I think our friends in the civil rights community will do so as well. And also, importantly, also important is ensuring that, in places where elected officials are not in charge, where those independent commissions draw districts, in the places I mentioned, organizing those communities to talk about where they live, where they shop, where they worship, so that they can make a case and actually walk in with maps to decision makers to give them a chance to have a district that truly represents their interests.
Well, and of course, Dan, as you well know, gerrymandering has an impact on actual policy. Healthcare is big on pretty much everybody's minds these days, so let's use that as an example. How can redistricting and gerrymandering have an impact on access to healthcare?
Yeah, so what you'll see on a whole host of issues, including healthcare, is that what gerrymandering does is makes seats very safe for one party or the other. It basically preordains which party is likely to hold a seat, which means that the greatest political threat to any incumbent in a district is not from the opposing party, it's from kind of an extremist within their own party. And so what they feel the need to do to protect their political flank is play to the extremes. I think the way that's played out in healthcare, for example, if you look at Medicaid expansion, the Center for American Progress recently released a really fascinating report looking at the impact of gerrymandering in 4 states that had some of the worst gerrymanderies coming out of the 2010 cycle: North Carolina, Michigan, Wisconsin, Georgia. And you see, a refusal to expand Medicaid, or in the case of one of those states, add burdensome work requirements in order to get health coverage. In Georgia, North Carolina, and Wisconsin, CAP estimated that there were 3,000 preventable deaths that took place as a result of the failure to expand Medicaid. So, this is a situation. I think you can also look at something like gun policy, for example, where gerrymandering has a body count. These aren't political games and just fighting between two parties. This affects people's lives when the policy priorities that involve the health and safety of Americans are ignored by elected officials who are more interested in protecting their political hides than doing the right thing. So it definitely has a huge impact.
Yeah, and that feels so much worse today than it ever has, to me anyway. But and something else, Republicans and Democrats alike are well aware of what's at stake here. They're just coming in with different views and positions, perhaps. Republicans launched a campaign called Right Lines 2020. What do we know about this campaign?
So we know it's part of a concerted effort by Republicans to ensure that they have the advantage in as many states as possible in drawing districts in their favor. The Right Lines Project is the more sort of directly partisan effort to win majorities, I think, in as many states as possible so that they can gerrymander districts in their favor. We've come up against sort of a partner organization, the National Republican Redistricting Trust, which is kind of technically, I think, sort of less directly partisan. I don't know that they engage in elections specifically, but they're certainly engaged in partisan adjacent activities. For example, we've seen them in court defend gerrymanders in Pennsylvania and North Carolina. And they are currently the funders of a lawsuit in Michigan, which is hoping to destroy the state's newly created Independent Citizens Redistricting Commission. They're coming into there with a strange legal argument. They've organized a bunch of individual plaintiffs in the state. They've said basically it's a violation of First and 14th Amendment rights of politicians, lobbyists, political insiders to prohibit them from drawing districts, to prohibit them from gerrymandering. Of course, if this was a good faith argument, they'd be saying, well, we want to, our lawsuit is designed to ensure that more people can participate on the commission. But of course, that's not the end goal. What they're saying is, well, we just think the whole thing should be destroyed. And we think, it's the power to draw districts should go back to Michigan legislators. And, so it's clearly a bad faith effort to ensure that only politicians have the ability to gerrymander districts.
Yeah, it leaves me shaking my head, I must say. We're speaking with Dan Vicuna, National Redistricting Manager at Common Cause. And Dan, Common Cause has been at the forefront of the fight for fair redistricting. You're one of 16 civil rights and democracy organizations that signed on to a set of principles that should guide the process. Give us a summary of what those principles promote.
Yeah, these are very common sense measures that ensure a fair and transparent process, but unfortunately there are places where they are principles that are resisted by the powers that be. A full and accurate census count, which you saw the administration attempt to thwart with the citizenship question. The elimination of prison gerrymandering, which is a situation in which kind of rural areas have an imprisoned population that really has no ability to participate in the life of that community, but that population is counted for the purposes of drawing districts, which really skews population counts. Strong consideration of communities of interest. We think that's the core of the redistricting process, allowing the people to talk about kind of where they live and what their communities are. Open and accessible meetings, again ensuring that transparency so that redistricting is no longer done behind closed doors, and ensuring that the communities have access to the data and the tools to allow meaningful participation, to allow citizens to come in with actual examples of districts, of drawn maps, showing what their communities are. So, just very clear rules that involve transparency, the disclosure of relationships between decision makers and non-decision-making participants, people who are lobbying the decision makers. Again, sort of a transparent process that maximizes fairness and minimizes partisanship. And we had a lot of organizations get onto those principles, and we have been doing our best through grassroots efforts in court, through lobbying in the halls of power to make those come to fruition in as many states and localities as possible.
Yes, as you mentioned, part of your battle is taking place in the courts. What are some of the victories you've seen in the last year?
Yeah, so just at the end of last year, we had a significant victory in North Carolina that may bode well for the future. So we challenged North Carolina state legislative districts under the state constitution, several provisions of it, a couple that have federal parallels, sort of free speech, equal protection, and one that does not have a federal parallel, the free and equal elections clause, which is we are making the argument around the country now, and made it successfully in North Carolina, and our partners did so in Pennsylvania in 2018, that this is a provision that should provide added protection that includes a prohibition against partisan gerrymandering. Unfortunately, the trial court in North Carolina agreed and struck down the state legislative maps there. Immediately following that, some of our co-plaintiffs in that case filed a separate case, and the attorneys at Arnold and Porter, the National Redistricting Foundation, filed a case challenging congressional districts, which also succeeded on the same grounds. We suffered a pretty disappointing result, last year in a case called Rucho v. Common Cause, in which the Supreme Court said that federal courts would not police partisan gerrymandering, but they did point to the ability to sue in state court. So we decided to take the ball and run with it, and so with that sort of instructions to go forth in the states, with a record created related to North Carolina's congressional districts that we created in Rucho, plaintiffs were able to use in state court and succeed there to strike down the congressional map as well. So hopefully going forward, that will be one approach to fighting this in the states.
Yeah, absolutely. Redistricting reform is another area where Common Cause has taken a clear leadership role. What can and what is getting accomplished in this arena?
So in 2018, we saw a record 5 states go to the ballot and pass initiatives to reform redistricting. Just an unprecedented number for 1 year. It's entirely possible that 2020 breaks that record. You've got several states, Arkansas, Oklahoma, Oregon, that have already gone public with campaigns, and we fully expect that some other states that are just in the planning stages right now are likely to announce efforts as well to collect signatures, put something on the ballot this November. And we are, where we have staff in the states, we're being as helpful. We're sort of taking a leadership role. Where we don't, we're activating our own members to participate in those campaigns. There are other places where there may be some defensive fights. One in particular is Missouri, where the legislature is fighting tooth and nail to undo the reform, the ban on partisan gerrymandering, the creation of a nonpartisan demographer to draw districts. That's something that legislators are trying to reverse. They're trying to give the power back to politicians, their own hand-picked lobbyists. So we're supporting the efforts of the Clean Missouri organization there to defend the reform already created. So we're working with allies, good government, civil rights, and others all over the country to defend where we have to and move new reforms where we can.
Yeah. And, for, I guess, at least 3 years, Common Cause has sponsored a writing competition, and it's called the Partisan Gerrymandering Writing Competition. What's the purpose of this campaign?
So the purpose of that effort was initially to give a kind of a legal framework for challenging partisan gerrymanders in court. And in some cases we got some very fascinating legal approaches, and in other cases we got some papers that developed really interesting measures for courts to use to demonstrate whether something is a partisan gerrymandering kind of mathematically. It was initially conceived with the goal of winning our Supreme Court case, Rucho v. Common Cause, try to get the U.S. Supreme Court to strike down partisan gerrymandering as unconstitutional. Unfortunately, that didn't work out the way we hoped it would, but fortunately, what it did do is create a network of academics, and generated relationships between those academics and advocacy groups like ourselves and civil rights groups to connect with experts who have actually helped us succeed in state court, again, like in Pennsylvania, Florida, North Carolina, to make a clear and compelling argument to courts in using kind of simple math that even lawyers can feel comfortable with, to demonstrate that something simply unfair, that a map isn't right and it's drawn for partisan advantage in a way that offends state law and state constitution. So we're probably not going to do that any further, but it achieved one goal in giving us some tools moving forward to litigate and hopefully win in court on fair maps.
And, of course, a central theme in your work to fight gerrymandering is to engage citizens in the battle. So how can average citizens make a difference?
Yeah, like I mentioned, there's going to be several states that have ballot initiative campaigns. So you definitely look into those efforts in states that have a League of Women Voters, a Common Cause state organization. We are frequently the leaders of those campaigns. Even in states that don't have a ballot initiative option, the work is obviously harder because you have to convince legislators to do the right thing. But there are public education campaigns to kind of slowly over time, hopefully shame these legislators, and getting connected with organizations that are doing community meetings all over the state to demonstrate what a problem this is and what some of the solutions are. We've sent commissioners from California who drew districts here, from other states. They go around the country to talk about how a citizen-led process works, which is really inspiring to a lot of people in states that have some of the worst gerrymanders to kind of imagine a different way forward. So, there are a lot of ways for citizens to get involved in these campaigns that are both directly kind of electoral and likely to go to the ballot in November, but also just to raise awareness, generate appropriate levels of outrage, and shame legislators, show up at committee hearings when these bills are going up. There are a lot of ways to plug in, so we hope people do.
Dan Vicuna, National Redistricting Manager at Common Cause, joining us today on the America's Democrats podcast. Dan, as always, we appreciate your time, appreciate the hard work you and the folks at Common Cause are getting done, and look forward to having you back again with us soon.
Thank you. It's always great to chat.
And same to you. And this is the America's Democrats podcast, the weekly podcast for stand-up Democrats. We want you to sit back and listen to this americasdemocrats.org podcast, a project of 21st Century Democrats. But we need you to stand up and fight. Do you want to get involved and help get our party back to its roots and to success at the ballot box? You can make your contribution to help us keep this show going and to elect Democrats who will stand up for democratic principles. Go to americasdemocrats.org and click on Donate at the top of the page.
This Social Security measure,
I believe that we must pass legislation to provide medical care.
This is our tradition. When our grandparents came to America, it was the Democratic Party which said, welcome. It was the Democratic Party, the party of Roosevelt and Truman and Kennedy and others, who said that America belonged to all its people, not just a handful of the rich or a few giant corporations. That's why great leaders like FDR fought so hard for Social Security, and why JFK stood up to the insurance companies and their Republican allies to get Medicare. It's not just one thing, or one time, in one place. It's about a whole history of standing up to the Republicans and saying someone has to be on the side of regular working people in America, whether it's defending Social Security or just the way your loved ones are treated on the job. That's what the Democratic Party is all about. And that's why this message has been brought to you by the Democratic Party. Working people like you and me.
Paid for by 21st Century Democrats. Not authorized by any candidate or candidates committee. This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. Coming up next, how Republican-led legislatures in the South are trying to prevent young people from voting and why. But first, we turn to Jim Hightower, America's #1 populist, for his common sense commentary.
Suddenly, social distancing is our new national etiquette, abruptly supplanting handshakes, hugs, gatherings, and other forms of ingrained communal behavior by us humans. Awkward, disconcerting, isolating. Yet, as we frantically scramble to deter the health and economic ravages of COVID-19, we might benefit by pondering a self-inflicted cause of the contagion's disastrous spread: social distancing. For some 40 years, American corporations and governments have imposed economic, political, and social policies to distance the financial fortunes of the wealthy few from the well-being of the workaday majority. Consider the interrelationship of multimillionaires with the unseen kitchen staff of restaurants where they dine. To further enrich themselves, such multimillionaires have forced low-wage policies on food preparers, denied health coverage for them, and lobbied to kill proposals to provide paid sick leave. So, a kitchen worker coughs because he or she is infected with coronavirus, but doesn't know it, since the worker has no health care coverage for testing. Even though running a fever, the staffer must come to work or lose the job. A few days later, a multimillionaire sneezes because, well, COVID-19 doesn't distinguish between rich and poor. The very proposals that plutocrats have been blocking for years, like living wages, Medicare for all, home health care, and others, are exactly what a sane government would adopt to avoid the consequences of inequality that now confronts every American. This is Jim Hightower saying the actual disease that's forcing social distancing on our country is the widening separation of rich elites from the rest of us. And the cure is a national push for renewed social cohesiveness. The catastrophic spread of COVID-19 reveals a truth we too often deny. We are a species of completely interdependent beings.
If you'd like more of Jim Hightower's real populism, check out the Hightower Lowdown. Jim's monthly newsletter gives you the real lowdown on which corporations, by name, are doing what to the middle class, our environment, and our democracy. Each month, the Hightower Lowdown brings you facts you didn't know, along with actions you can take to fight back. It also comes with a sense of humor. Hightower believes we can fight the gods and still have fun. Plus, get this, it's cheap. Only $15 brings you 12 issues a year. For real populism, go to hightowerlowdown.org.
This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. Voter suppression has a long history in the American South. Writer Benjamin Barber says that for young voters in the South today, that history lives on. And we say hello to Benjamin Barber, researcher and writer with the Institute for Southern Studies. He's written extensively on Southern politics and efforts to curb voter participation across the South. Ben Barber, thank you so much for joining us today on the America's Democrats podcast.
Thank you. Good morning. Thank you for having me.
It's our pleasure to have you with us. I'd like to start by talking about young voters in general. When you refer to young voters, who are you talking about?
Yeah, I'm talking about voters who we tend to consider a part of the millennial generation and the Generation Z demographic. So people usually in the age range largely between 18 and 29. And I think this is important because we saw this age group play an important role in the 2008 election, and many of y'all expected them to play an important role in the 2020 elections.
Just how important are these voters in the overall electorate?
Yeah, now young voters actually represent a larger percentage of the nation's electorate today than their older counterparts. Millennial and Generation Z voters now make up nearly 40% of the 2020 electorate, and this is an increasingly growing trend. Historically, younger voters have participated in elections at lower rates than older voters, but what we have seen now is actually increasing voter participation among young voters. In 2018, for example, youth voter turnout nationally rose 16 percentage points from the last midterm election in 2014. And this trend is also being seen in southern states where we saw massive participation among younger voters. For example, I think youth turnout in Texas, for example, tripled from the last midterm election. And I think this really represents a growing demographic that will have a significant impact on future elections.
Well, you recently wrote an article for Facing South titled, "As Young Voter Participation Has Grown, So Have the Southern States' Effort to Curb It." What are some of the obstacles that can potentially discourage young voters?
Yeah, so we have seen a number of obstacles being implemented, especially in southern states. I want to emphasize that. For example, 17 states have passed laws in recent years requiring voters to show IDs to cast a ballot. But 7 of those states refused to accept student IDs, including South Carolina, Tennessee, and Texas. In Texas, you can actually vote with a gun license but not a student ID. And we have also seen efforts to suppress student voting by penalizing registration efforts by nonprofit organizations. We have also seen the closing of campus polling places, which really impacts students on college campuses. And a lot of these attacks, I think, are in response to this growing demographic that as I said earlier, will have a major impact on future elections and really have an impact in shifting the political calculus in this nation.
Are the barriers that you're seeing, is it worse in the South than it is anywhere else in the country?
I don't know if you could say that. I would. It's definitely being targeted in the South. Yeah. I think it's important to know that many of I think it's important to say that as well. As you said, it's largely being done in the South. I know, for example, last year in Tennessee, the state legislature passed a law that imposed criminal penalties on organizations that return incomplete applications or fail to comply with certain requirements. And, this is directly targeting voter registration drives on college campuses. In Florida, for example, there's an attempt to ban early voting sites on college campuses. Their law actually says that early voting sites have to have sufficient non-permanent parking, which as you may know, many college campuses lack. And in Texas, for example, they have banned a program that allow for mobile or temporary polling places, which help provide access not only to college students but to also rural communities. But with this gone, this actually creates new burdens that many young people, especially in the South, are now facing. And I think, but as it's a trend across the country that you are seeing with these new laws, but I think it is really seen mostly in the South.
Mm-hmm. And, in your article, Ben, you also note that often it is Republican-led legislatures that have erected barriers to voting that disproportionately affect youth. Why would Republicans have an interest in doing this?
Yeah, well, as I mentioned earlier a little bit, that these laws have been specifically designed to suppress youth turnout, and especially young voters of color. I want to emphasize that as well, who don't necessarily represent a large part of that particular political party. And I think that we are seeing an attempt to maintain power by really trying to limit who votes in elections. And I think the attacks that we are seeing are, like, as I said earlier, a direct response to this growing young and diverse electorate that is really emerging in this country and will really have an impact on elections in the future.
We're speaking with Benjamin Barber, researcher and writer with the Institute for Southern Studies. He's written extensively on Southern politics and efforts to curb voter participation across the South. Ben, you also note in your article there has been significant pushback in the courts against some of these barriers, but how successful have these efforts been?
Yeah, so, well, as you may know, many of these cases are still being settled in court. We have seen some progress in North Carolina, for example, where voters in 2018 approved a voter ID as a constitutional amendment. And this law has strict requirements that universities have had to follow for student IDs to be accepted. But that law has now been placed on hold and is not required for the 2020 elections. But for the other cases, they are still being settled in court, and hopefully we will see some successful results from that as the year continues.
It's funny, you not funny, haha funny, but you often, I sort of get the feeling that we make a couple steps forward and then somewhere along the way somebody throws a wrench into it and we make a couple of steps backwards as far as voter suppression goes. Yeah. Do you get that same sense?
Yeah, well, as I said, I think it's, it's very intentional, it's very designed to the progress that we have seen in recent years. It's really a backlash to the 2008 elections, I believe. Not necessarily the candidate, but the electorate that was able to push through in states like North Carolina, for example. And I really think that what we are seeing is a response to the progress that we have made in terms of, especially with young voters, people of color, voters of color, and this coalition that has been built around that base, and how successful it has been. And what we are seeing, these attacks that we are seeing, are really trying to kind of stifle that progress from moving any further, I believe.
Mm-hmm. Well, and of course, the goal is to encourage young voters as opposed to discourage them. What are some of the most successful ways to do that?
Yeah, so what I have found is that, many young voters want the type of change that leads to action on the issues that this country is facing. So what I've found is a lot of young voters want action on the issues of climate change, action on the issues of student debt, action on the issues of creating a more equal and just society. And I think it will really be the youth that force us to address these issues. And I think it is important to note that, throughout history, it has always been young people that have led the movements of change in this country. And I believe they have the power to do it again in this moment.
Fingers crossed, and when wishing you continued success on your work and hopefully breaking down some of these barriers. Benjamin Barber, researcher and writer with the Institute for Southern Studies, joining us today on the America's Democrats podcast. Ben, we appreciate your time with us. Would love to have you back and talk some more about this down the road.
Yes, sir. Thank you for having me.
You're quite welcome. Thank you for joining us. And this is the America's Democrats podcast, the weekly podcast for stand-up Democrats. We want you to sit back and listen, but we need you to stand up and fight. Help get our party back to its roots and to success at the ballot box. Make your contribution to keep the AmericasDemocrats.org podcast, a project of 21st Century Democrats, on the air, and help elect stand-up Democrats. Go to AmericasDemocrats.org and click on Donate at the top of the page. This is the America's Democrats podcast, the weekly podcast for stand-up Democrats. Deny and delay, assessing Donald Trump's response to the coronavirus pandemic. Bill Press talks with Politico reporter Dan Diamond.
So, Dan, I was in the briefing room yesterday at the White House. I heard the President of the United States say about the coronavirus, it's something we have tremendous control of. And then I heard Dr. Anthony Fauci come to the microphone and say, the worst is yet to come. Which is it?
When facing a national medical emergency, I might trust the doctor over the president. We are staring down a pretty big problem right now, and the president has consistently underestimated, privately and publicly, the threat facing the nation.
And what impact does that have on getting on top of this crisis?
Well, Bill, I think it does start from the top. There have been a number of stories that I've written for Politico about the administration's response. Some aspects are direct from the White House. The White House could have chosen to be more aggressive from the jump back in January when HHS Secretary, the Health Secretary, Alex Azar, first brought this to the president as something that he thought should be a priority. But there were senior officials in the White House who didn't think it was as big a deal as Azar was making it out to be. The president himself wasn't sure that this was going to be a threat. For weeks, the U.S. response was played down. I also think just taking cues from the top is essential when there is a national crisis. And the president's rhetoric has led some percentage of Americans to believe that this isn't a problem when every medical expert around the world is warning that this is one of the biggest threats in years to health systems in every country.
And I guess the question also is how prepared we are to deal with it. I notice in your political pulse today, I see the statement, the system isn't prepared for what's coming. And yet again, in the Rose Garden Friday, I heard the president say, quote, no nation is more prepared, no nation is more equipped. Again, what's the reality?
I think it would be nice if those things were true, that the U.S. system was the most prepared and the most equipped, but in many ways we are not. We do not have the same command and control structure that some nations like Singapore, like China, have been able to bring to bear to lock down the population quickly, to impose a lot of curbs. It's been much more piecemeal so far in the United States. Now, some of that is good. We're a democratic nation and there's a lot more free will and individualism. But when it comes to preparing for a crisis like this, it means that the response has been much more scattershot. I also think, Bill, we have been behind on some pretty basic things. One of the most important has gotten a lot of attention in recent weeks after my colleague David Lim at Politico wrote the first story. Most of the labs around the country did not have working testing on coronavirus. And that has just left us flying blind at a time when we have limited resources, and not knowing where to focus those resources is a really big problem. The other way that we're not prepared is, frankly, our hospital capacity. I used to work in the hospital consulting industry, not as a direct consultant, but kind of doing research and writing. The concern that hospitals had for years was that they had too many beds. They had too much space, and they were losing money on these empty units. So they started cutting them down. Maybe 20 years ago, there's been a lot of consolidation. Hospital systems have generally gotten tighter as more patients have been shifted to outpatient procedures. That's good if you're a patient who doesn't want to spend a night in a hospital, but that's going to be very tough at a moment when many of these coronavirus patients will need extended care, and there aren't enough beds at current projections to serve all of them.
I saw from the CDC on Friday, they projected, on your point, that perhaps as many as 2.4 million to 21 million Americans might require hospitalization. They say our current capacity is 925,000 beds total in this country.
That sounds right to me, though I don't have the numbers in front of me. The theory being, Bill, that if there is a surge in patients, a few things would happen. One, all of the other beds would be as cleared up as possible. So if I need my elective surgery on my knee injury, or if there's anything that can be pushed off, those things would be delayed, canceled, so we would have beds available to the maximum ability we can. A second tactic that I've heard from hospital leaders that I've talked to is simply renting space in hotel rooms or in public arenas, places where there could be an opportunity to set up almost wartime makeshift hospitals if we need those. And then I think there's also going to be a major push to just keep people home if they don't need critical care. That will be tough because I think many Americans get nervous, understandably, when they have symptoms that could be coronavirus, but there will probably be some national education campaign of who should be going to the hospital versus who should, if someone is unlucky enough to get these symptoms, just ride things out at home. And one final point, those projections from the CDC, those big numbers certainly could come to pass, but there is also a very good chance that if we are severely limiting movement, if we're putting these quarantines into place and locking down businesses, we can slow and change the trajectory of this in a very big way. And that could be good, not just for the American people and the hospital industry, but frankly, for the scope of this outbreak around the world.
And that is one point that Dr. Fauci makes every time I've heard him, which is we're trying to flatten the curve, to your point. But is this, and in the Democratic debate between Vice President Biden and Senator Sanders Sunday evening, particularly Vice President Biden talked about the use of the military, and one thing they could do is build temporary hospitals and tents or whatever, that they're prepared to do this. Is that the case, and have we ever done that before?
Well, it is quite possible that there will be a military mobilization, which we've seen before in public crises. I believe in Hurricane Katrina or other major disasters, the military does get involved and do a lot of field work, essentially. We may well need that, given the threat to health workers and the demands on the system. And I will say that is something likely in the offing in the days and weeks to come, just given how fast things are moving and how much more aggressive the nation's response has ramped up to be.
Do we have enough respirators? Do we have enough ventilators? Or are there enough in the supply chain to, if needed?
Frankly, probably not. The condition that results from serious coronavirus infections is essentially respiratory failure. People just can't breathe. And the need for ventilators and intubation has become paramount. In many cases, I was talking to some medical workers I know, there's now a move to be more aggressive at putting people onto tubes and helping them with breathing even before their problems get really severe, because that way you're staving off the potential problem and you're reducing the risk that when that person's illness is more severe and a worker's then trying to intubate that person, it's more likely that someone who's coughing and spitting up a lot then could infect someone else. So doing it early. But that will just mean more strain on the current resources. Hospital leaders are really worried about this. And the Trump administration has not been clear with how many ventilators and other crucial supplies are in the system. The message that the administration has been putting out, even on Fox News, which is historically very friendly to the administration and has not been happy. Hosts like Tucker Carlson have not been happy with this response. But the response has been, we don't want to get to a point where we're tapping our emergency supplies, so let's try and keep as many people out of the hospital as we can, which is the right answer in terms of the priority. But I think that's telling. We just don't have the supplies right now, and the administration is feverishly working on trying to boost the supply chain and get these supplies in case we need them in the coming weeks.
Again, here on the Bill Press Pod, we're talking with Dan Diamond, author of The Political Pulse. If you haven't and are not a subscriber to The Political Pulse, if you haven't signed up for it, you should do so right now, particularly these days. It's up every morning. Dan, if I may ask you, what about testing? Let's talk a little bit about testing. What is the status today? The White House promises, again, I was there Friday and Sunday. They kept saying this week we're gonna really expand the availability of testing. What's the status today, and how soon do you expect it to get better?
The Trump administration has been running consistently behind on virtually every testing promise. We have been in the dark on where the problems are, and that has caused all sorts of downstream effects for not just where public health workers can prioritize their response, but also how urgent the administration thought this problem was. And when there was no testing and no real results other than a few cases that had been identified, that created a false sense of security. I think now the administration is trying aggressively to get more testing online. There are basically three different kinds of tests, Bill. One is the testing that is done by the government, either at the CDC or through what are known as public health laboratories. This was the testing that broke down about a month ago, where labs just could not use the CDC test. It didn't work. That created all kinds of delays as officials waited around for the new CDC testing. There have been more tests coming online from individual hospitals and clinical labs. These tests could have been brought online weeks ago, but they were caught up in bureaucracy. President Trump has said that these tests were caught up in President Obama's bureaucratic restrictions. That is not true. The restrictions were actually signaled by the Trump administration, and the Trump administration could have waived those restrictions at any time, but just didn't do it until more recently. So hospitals are now finally bringing their own tests online. And then the biggest testing change is likely going to be what was announced at the end of last week, when companies like Quest and LabCorp got into the mix and said they would use their big automated systems to start doing tests at scale. Right. So we are starting to get the testing capacity. And I know, having talked to officials in the administration, they recognize this is both a practical problem as well as, one person told me, like a psychic problem of just all the stress and fear it creates not to know what's going on. But it's just running way, way behind where it should be.
We are, a month behind, would you say? Where we should be?
It depends who you ask. I think an optimist would say that we're 2 weeks behind. A realist might say we're 4 or 5 weeks behind.
Isn't one other question? You mentioned the problems initially with the CDC tests, but before that, we were offered, as my understanding, tests already developed and proven to work by the World Health Organization. Why didn't we take those?
That has been a question that I am still trying to solve in my own reporting. I've said this before on radio. If anyone knows the answer, my email is open and my messages are open. But I will say, Bill, that some have cautioned me this is not the biggest problem. Yes, there was a working test that we could have tapped, and in retrospect, that might have solved many problems. There were health officials, though, who worried that that test was giving off too many false positives, and that the U.S. CDC, which historically has been really good historically has come up with high quality testing, that we would be better served just going with the CDC. So it has been a defensible decision even by people who historically criticize the administration, but it still remains one of the biggest mysteries. And there might be more to the story, or it might just be we thought we could do it better and we didn't.
Now, I'm just a layman, very much of a layman when it comes to public health issues, but I keep wondering this, and I'd love to ask you, if we are not testing or don't even have the capacity to test as many people who maybe should be tested, isn't it true we don't really know how many cases of coronavirus there are in the United States?
You may be
right?
You may be a layman, but that is the accurate expert perception. There are estimates that the number of cases is anywhere from 10,000 to 50,000, maybe even higher at this point as we talk at the beginning of this week. But that means a couple big things. One, it means that the cases are spreading now in community outbreaks that officials still don't realize the extent of. It also means that the coronavirus is seeded enough, it's in enough places that even if the United States takes big steps, like cutting off travel from Europe most recently, it probably won't do as much as the move to cut off travel from China did 6 weeks ago.
The follow-up to that, it seems to me, again, layman speaking, is that once we do start more testing, that the numbers of cases in this country is going to spike. And we have to be prepared for that, I guess, right?
Right. I mean, a public health official might say this is a good thing. The more that we know, even if that means higher numbers, the better ultimately for the public health response. But the true number is so much higher, Bill, than the official statistics that have been put out. I've talked to doctors, health workers around the country that I know or have reached out to me who say again and again, we have 5 cases, 10 cases, 20 cases, and in one case, 49, 50 cases. And these numbers are not showing up in the public accounting that is put out by the CDC or pointed to on various websites. That's because of the lack of testing. It's also because of the lack of coordination right now. And the true number, when it comes out, I think will surprise some people who have been relying on the official statistics.
How effective is the drive-through testing? Is it as good as going into your doctor's office?
My understanding is that the drive-through testing that has been used in South Korea, for instance, is good in that it allows someone, say I'm worried that I have coronavirus. I can get in my car. I don't have to expose anyone else. I drive up. The people in the protective equipment administer the swab, and I get some clarity rather quickly about whether I need to quarantine or perhaps maybe my symptoms aren't from coronavirus. So it provides some value there. But my understanding is that the drive-through testing is not as thorough or perhaps as accurate as some of the testing that might be done in a lab. There might be a higher rate of false positives. It's still far, far better than the current system where we're just operating often in the dark.
Bill Press talking with Politico reporter Dan Diamond. If you'd like to hear the entire interview, visit BillPressPods.com. Well, that's all for the America's Democrats podcast. Thank you to all who made today's show possible. Dan Vicuna, Benjamin Barber, and the entire Bill Press team. And thank you for listening. If you liked what you heard, please get involved in our efforts to keep this show going and to elect Democrats who are bringing the party back to its roots. Go to americasdemocrats.org and click on Donate at the top of the page. And be sure to find 21st Century Democrats on Facebook and Twitter, and leave us a review on your favorite podcast app. For the America's Democrats podcast, I'm your host, Jim Cuddy. We want you to sit back and listen, but we need you to stand up and fight. Join us. Support the americasdemocrats.org podcast, a project of 21st Century Democrats, and help elect Democrats who will stand up for democratic principles with your contribution today. Go to americasdemocrats.org and click on Donate at the top of the page.